Hello, good morning. Happy Friday to everybody. I'd like to welcome our two guests who are going to talk about top 10 tips palliative care clinicians should know about music therapy. It is a part of an article that includes music therapy and art therapy. However, this morning we're just focusing on music therapy. I'd like to have a big welcome to Mel. And Mel, I might mispronounce your last name.
That's okay.
Schrovitz? Did I say it right?
Mm-hmm.
Yay. Mel is a board certified music therapist currently employed at Penn Medicine Hospice in Philadelphia. Mel earned her undergraduate degree in jazz performance and music therapy through a joint program between Westchester University and Immaculata University. Did I say that one right? Sorry. And a master's in music with specialization in neurologic music therapy through Colorado State University. Mel has been working primarily in hospice care for the past 7 years and also currently serving on the board of Mid-Atlantic region of the American Music Therapy Association. And then also Dr. Kwok. Ian Kwok is a palliative care physician and director of community outreach and education at the New York Presbyterian Weill Cornell, working towards integration of creative art therapies for patients with serious illness. He also serves as an editorial board member of Art Therapy Journal of the American Art Therapy Association and is a program committee member of the Art Therapy Project. Welcome to you both, and we're very interested in what you're sharing with us this morning.
Of course, thank you so very much. And Ian, I'm sorry I didn't say hi to you when you came on. I was fiddling with my screen, but lovely to see you this morning. But yes, thank you all so much. Definitely a pleasure to be here today for both Ian and myself, just to discuss a little bit about music therapy within the realm of serious illness, end-of-life care. And this is, just as Rachel and Martin said, based on a recent publication that we had in, I guess it was published in 2021 at this point, top 10 tips.
I think the print version was January 2022, so I think we're still relevant. Yeah.
Still relevant, glad to hear it. So based on that, and of course we can share that with anyone who's interested if you haven't seen it yet. All right, so the purpose of this very brief talk today is really just to help everyone gain a better understanding of what music therapy is. When Martin and I were introducing ourselves to each other and getting to know each other, he really emphasized to me the limited experience and awareness that a lot of people have with music therapy, and that's not a surprise to myself or to Ian, unfortunately. So really today, just trying to develop or start to develop a deeper understanding of the music therapy discipline within serious illness end-of-life care based on the training requirements for music therapists, to gain an introductory understanding of music therapy through the lens of palliative and hospice realms of care, and to understand the scope of music therapy practice within serious illness and end-of-life care for purposes of referral decision-making and interdisciplinary team collaboration. And you're going to hear a lot of my voice today, but of course, Ian, you can feel free to jump in whenever as well. So we can't talk about music therapy and jump in without really understanding what music therapy is. So the standard definition, this is from the American Music Therapy Association, defines music therapy as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who's completed an approved music therapy program. And here I always like to highlight the idea of individualized goals. So just like all of you, whether you're a physician, a nurse, a social worker, chaplain, we all document and create our plans of care that are individualized based on patient and family caregiver needs, whoever is present. As patients decline, those needs are going to change. And that's something that we are constantly assessing during each visit that we have with whoever is present. And being holistically present with everyone can be really difficult, as you all know, but allowing a modality such as music therapy to create this space, this container for our work to be facilitated and experienced together can really help to benefit the patient based on physical, emotional, social needs, etc. And of course, to be a music therapist, there is a lot of required education and training that goes into it. Right now in the United States, I believe there's about 72-ish approved programs, might be a little bit more at this point from when I last looked. But we're required to take courses, obviously music-based courses, but also biology, anatomy, and physiology, psychology, verbal-based training, and of course our core-based music skills as well. And on top of that, completing 1,200 hours of clinical training as well, both fieldwork levels such as didactic and geriatric care, and also at an internship level for 6 months. For myself, I did that in hospice care, just really trying to gain an understanding, a deeper understanding than you will from just a very brief practicum training.
And Mel, just to reinforce, I think it's really important that we emphasize that this is a professional modality and one that has really gone through significant and now very standardized educational practices and experience in healthcare settings. So, I think when you have that high level of experience and abilities, you really want to match those people with people who really need the most and the most complex patients, which is of course why I think it's such a great natural partnership with palliative care. And we'll talk a little bit more about those parallels going forward.
Yes, thank you. So to dive a little bit deeper into what Ian was just starting to talk about, in palliative care, and especially in hospice, because of Medicare requirements, we have volunteer services. And unfortunately, when you go online to a job site and you search for music therapy and hospice, all these jobs come up, it's awesome, until you realize most of them, unfortunately, are just volunteer based. Volunteers are extremely important, but when we get into music therapy versus volunteer music services, we're focusing on the idea of professional creative arts therapists, in this case, music therapists, again, emphasizing this idea of individualized, goal-oriented care that's facilitated within a therapeutic relationship. And going through with that, with the specific training and experience that music therapists must have to engage with end-of-life needs for patients and caregivers. This idea of supporting in anticipatory grief and post-death support and grief processes, something that's extremely important to be aware of, especially if you have a music therapist on staff and you're thinking music therapy or volunteers, I'm not quite sure. For a volunteer's purpose, their work is more concrete level, not specialty level clinical therapy. There's no specialty training that's involved. And the biggest concern that we have in using a volunteer versus someone who has a specialized training is this idea of contraindications. Harm can be done. People say music therapy or music in general, there's no harm involved, but that's definitely not true. So having this training, we're able to assess, for music, there are ideas of trauma that come into play. I have a patient right now who was a Holocaust survivor, and yes, he might really love Yiddish and Jewish music, but if we're not able to be present to really process the memories that are evoked in that music experience, in the thoughts and feelings, and we're not paying attention to the nonverbal signs of pain, of trauma, that can be extremely harmful. And then we leave patients in that negative setting in just a volunteer-based experience. That can be really dangerous for both the patients, for the caregiver, for family, whoever is present, to have to now kind of sit in that space. So for music therapists and other, art therapists as well, making sure that we have that training to be aware and to appropriately respond in the moment and to adapt what we're doing to make sure that the needs are being met. And if it's contraindicated, music therapy might be discontinued for that patient if other adaptations that we've tried don't work. Anything you want to add, Ian?
No, I think that's such an important point. We actually have one question in the chat. I'm wondering if you can address, Mel. It's from Richard Buton. Are all music therapists accomplished musicians?
That's a great question. So to be a music therapist, you have to have skills in music, obviously. So to graduate from a program, you have to be proficient on piano, guitar, various pitched and non-pitched percussion instruments, and in voice. That doesn't mean that you have to have a degree in performance before you start to study music therapy. It doesn't necessarily mean that you have to have any interest in performance, because music therapy is not entertainment. Music therapy is not a performance-based modality. That being said, of course, you have to be proficient in the creation and active experience of music making, because for the most part, music therapy practice is all live music, encouraging that interpersonal engagement with a patient, whether the patient is engaging receptively or they are attempting to engage in active music making. The patient themselves do not have to have any prior music experience, any interest in playing music or performing. That is not a requirement for the music therapist, of course, being proficient, because if the music doesn't sound good, if it's not aesthetically pleasing, that can cause harm as well.
And I think one thing I think I've been really impressed with seeing music therapists work is, not only that kind of mindfulness to, indications versus contraindications, but almost this ability to really understand what modality or what kind of approach a patient or family really needs, and being able to adapt to that. So that assessment process, I think, is something that it seems so seamless, because it seems like they come in and they start doing something and it seems to just work. And that part of that is really understanding how to match both, physical capabilities, where they are emotionally, how to understand the kind of context of everything else going on, and really matching that. I see, Marty, you have your hand up. Feel free to ask your question.
Yeah, so one, I had no idea that music therapy could cause harm. So I really appreciate you sharing that.
Of course.
Have you noticed that there are certain things that music therapy struggles to try to address? Like, are there certain domains or certain symptoms or certain scenarios where music therapy really struggles to make inroads?
Sure. And in a way, of course, that's a difficult question to answer because of how individualized this work is, because every patient is different. So, working with a patient with dementia, doing something specific in terms of patient preferred music and reminiscence, memory recall can be great for one patient and might have no effect or have a negative effect for someone else. In terms of the research, I think specifically when I think about diagnosis, Huntington's disease, that constant movement, unfortunately, there hasn't been a lot of positive research in showing the positive or, effect of music therapy for someone who's experiencing that constant movement, how we can help to calm that down. But that's just diagnosis specific. That's not person specific. So there are some patients with Huntington's disease who, when they're experiencing, whether it's their preferred music or just a focus on whether it's relaxation techniques, mindfulness-based techniques, guided imagery, that really might help them. So I think, again, we always have to remember that these are not just patients, that they are full holistic people when we're engaging in trying to find research to help us decide what interventions to facilitate in a session. But I definitely think there are certain diagnoses that are just less researched within the realm of music therapy. And of course, trauma-informed care. Sometimes music therapy just won't be appropriate for someone if their trauma level is just so deep, if they haven't had the therapy that they need to go through, whether it's more verbal based at first, that might be more familiar for them, and then initiating music therapy after. But yeah, I mean, there's still a lot more research to come into play, of course.
And one additional, I think, just practical barrier I see is really just misconceptions around music therapy. So in the same way that I think often palliative care might be helpful, unless it's been framed in a way where everyone's like not really even open to it in the first place. Music therapy really deals with a similar kind of barrier. So I think it's really up to us and for medical institutions and medical providers kind of all over to really understand the profession better and be able to at least introduce the concepts in a way that is more, I guess, just accurate to what music therapy provides. And I think, one of those barriers often is that there's a misconception that it's usually more for pediatric populations. And that is absolutely not true. And I think that we really miss out on a lot of opportunities there because of those misconceptions.
Definitely.
Rachel, I see you have your hand up as well.
Yes, I had a quick question. In the past, I worked at a hospice organization that had a few music therapists, but also music thanatologists. And I know those are more, I believe, more rare, if I'm correct. And I just wanted to see if you could speak to the difference of those two specialty specialists, I guess.
Yeah, so to be honest, I don't know a ton about music thanatologists. I've heard of them. Um, from what I have gathered in discussion with colleagues, is that I don't think their training is to the level of what a music therapist is. And when I also think about music thanatologists, from what I've heard, most of them are like the harpists that walk down the hall. And so they're in the inpatient setting with patients who are potentially actively dying, and they're just sitting there and they're playing some relaxing music, and it can be beautiful. It can have a great benefit for patients, but it's not, there's no creation of that individualized care plan, working within that therapeutic relationship, that triangular relationship that we often talk about, with the music and the therapy and the music therapist and the patients, what's happening within that. So that's kind of what I know about music thanatologists. Again, that training, I don't think there's, in terms of like credentialing, board certification, I'm not aware of anything for that. But
And
it's
it's not to
really,
say that, they wouldn't have that experience or wouldn't be, helpful. I think we want to, we really want to emphasize that we think, including creative arts approaches and different modalities for patients experiencing serious illness is really important. We don't want to exclude people from that. That being said, the quality and the ability to really understand high risk, high complexity situations, that is just simply not standardized out there. So we really can't guarantee that, if you're using a music volunteer of any kind, even if they have plenty of experience, one thing that we can just really say about music therapy specifically is that they do have that standardized training, and that that's exactly what they are trained to do.
right. And exactly, and that's why, somebody coming in to use the harp, if they are a thanatologist, can, like I said, be a wonderful experience for them, but it's just not at the same level as music therapy in terms of the standardization, as Ian is saying, the training and all of that we're aware of. Okay. There we go. So Ian, did you want to speak a little bit to this before I jump in again?
So just on a practical level, I know not every service has a music therapist available. That being said, I do want to talk very briefly about kind of what indications might look like on both kind of an inpatient and outpatient context. So there are some models of palliative care teams that do have a music therapist or other creative arts therapists on their inpatient or outpatient teams. So that's something that I think if you're interested in, there are some great resources in these references here. If you reach out to us, happy to kind of help fit your needs and understand what you're looking for. One, I think, really easy way to just kind of explore is just to ask what kind of music people like, or what kind of things can provide some meaning. So one thing that I, just to kind of get the conversation started from the perspective, this is not music therapy, but this is just something to, if you're looking for ways to kind of start introducing that modality. I personally really love asking what your favorite song might be. And that's always a very meaning-laden kind of a question that you can really explore if you're in the right place for that. Again, keeping kind of trauma-informed principles in mind. Ultimately, screening for interest is the important thing to note is you don't have to have skill, experience, or even like music to participate in music therapy, though. I want to really make that clear. The whole point of music therapist's ability to provide that kind of assessment is to really be able to match people's different needs. So that should not be a automatic kind of rule out of music therapy. Also, I think one interesting application that I've noticed is the use of creative arts therapies and music therapy in particular in medical education and in supportive teams themselves. So I know a lot of palliative care fellowships have sessions of art therapy or music therapy that I think are incredibly valuable, especially as someone who identifies as who spends a lot of time thinking linguistically. I think for us in particular, it's really helpful to have different modalities when we're really trying to switch modes and kind of look inward and understand kind of how we're feeling on a different level, on a different plane. And I think there's so many wonderful kind of synergies there with creative arts therapies. And again, there's a lot more I can talk about, but I think in the interest of time, we can move on to the next slide.
Perfect. Okay, so yes, in the interest of time, I think we're basically out of time for the presentation piece, although we are kind of integrating questions, so that's great. We just wanted to close with an example that is in our paper, kind of the idea of tying together music therapy with these guidelines that were introduced, the National Consensus Project Clinical Practice Guidelines of Quality Palliative Care, showing the synergistic idea of how we can think about the needs for patients and all those domains that we always think about, and how music therapy can meet some of those needs, and why music therapy then will be referred for a patient. So I'm not going to go through all of these, and I'm sure for the most part these are pretty familiar to all of you at this point. So we have another slide finishing it out, but something to highlight here is, for instance, the psychological and psychiatric aspects of care. So for music therapists and creative arts therapists in general, really honing in, honoring who the patient is, and getting away from thinking just about themselves as a patient, but as a person, honoring their dignity, their autonomy, their continued ability to engage in meaning making, whether that is through song selection, which, as Ian said, I think on the surface level that could sound very simple, just picking songs, but it has so much meaning within it in terms of who they are, who they identify as, their experiences, their history, and that can lead to the creation of legacy projects, which again is another idea that is very familiar for us as palliative care and hospice clinicians, but has so much power for patients and family members when we think about anticipatory grieving, when we think about how to support patients and loved ones in that engagement of closure, what they want to say, especially in a patient who might be struggling with verbal communication, to be able to use a different modality creatively to communicate what they really want to say or express before they die is extremely important. Social aspects of care, the same thing, really holding on to this relational, interpersonal connection that we can still have even if communication or physical functioning has left us. We know from research that the brain is still able to process auditory stimuli. We're still able to take in information, to hear, even if we're not able to overtly respond or express. And so that can be really important for loved ones who are engaging within this really special space together with the patients. And these are some of the other domains that are listed, again, all familiar for people, I think. But again, this idea of just honoring the patients at the end of life, legacy work, helping to reduce terminal agitation, this idea of the ISO principle that music therapists often focus on. That's not just a music therapy term or a practice idea, but it's this idea of connecting with the patients, following their heartbeat. If they're set to a monitor, we can assess that, or their breath rate, matching that in terms of in training, and then slowing the music down, speeding the music up wherever the patient might need to go to help with increasing that sense of total comfort that we're always looking for. Ian, you want to add anything?
Yeah, I guess I feel very lucky that I kind of came across creative arts therapies early in my medical training as a medical student. And I was just really struck by how much overlap there is, both in terms of just the kind of the way of thinking and just the way that kind of, I mean, as a therapy, it is applying all the same kind of therapeutic principles that we talk about all the time in our work. And when you really, think about who are the patients who really benefit the most, both from palliative care, it's really the same patients who benefit the most from creative arts therapies. And obviously there are some practical barriers to that, but I think that we're really talking about the same things, and which is why I think we should really look for opportunities to collaborate as much as possible. I know that we're running low on time here. So I see that there's one kind of final question in the chat, which is, can we, thank you, Marty, can we ask you both the same question we ask our patients? What is your favorite song? And if you feel comfortable also saying why. Mel, do you have an answer for that? I have one in mind.
So I am a huge fan of Jackson Browne. His music for myself is very simple, but the meaning behind the words, the imagery that he creates through his lyrics are really important to me. So he has a song, Your Bright Baby Blues, that really just goes into his own internal processing and this relationship that he has with someone and his own internal struggle. So I really, from a personal standpoint, really connect with that. Thanks for the question.
On my end, I'm going with a classic by the Beatles, Hey Jude. I think it's like the ultimate comfort song, and also, you know, such amazing lyrics, you know, like literally take a sad song and make it better. So I think that's a great metaphor for what we're trying to do both in in the creative arts therapies and in palliative care.
Lovely. Thank you guys so much.
Of
We
course,
really
I'm gonna,
appreciate it. Yeah.
let me see if I can stop sharing, new share. Let me see, just in case.
Has any further follow-up questions, feel free to email us or reach out via, you know, social media generally. I'll put my email in the chat. I'm on Twitter. I'm any way is good. We love talking about this stuff.
We can find you, right?
So we're just really excited because I think there's so many opportunities for us to collaborate. And as you can see, you know, I mean, I feel very lucky to have worked with Mel and, you know, other kind of leaders of the field in music therapy who, from my perspective, are really, really well primed to work with us, and they're doing really great research already.
Brilliant.
Well, thank you.
Thank you
very
both for your
much.
time. Have a beautiful Friday, everyone. Thank you.
You as well. Thank you. Take care.